Croup is usually a viral infection that affects the upper airways. This can cause a barky cough that can sound like a seal. Stridor is an abnormal, high-pitched noise with breathing that results from narrowing or swelling of the upper airway. Stridor can be very scary for parents. Welcome back. Today's talk is on croup. Croup is usually a viral infection that affects the upper airways, including the windpipe, also called the trachea, and the voice box, also called the larynx. When the upper airway becomes inflamed, this can cause a barky cough that can sound like a seal. Sometimes croup can also cause stridor. Croup commonly affects children less than 5 years old because the airway is shorter.
What is stridor?
Stridor is an abnormal, high-pitched noise with breathing that results from narrowing or swelling of the upper airway. As an ER physician, there are some things that get you out of your chair very quickly, and stridor is always one of them. We know stridor can be very scary for parents. You should always see your doctor if your child has stridor.
Sounds scary. How do you get croup?
Croup is usually caused by a virus. Parainfluenza virus is the most common virus that causes croup, but many other viruses can cause it as well. You can get the virus by breathing it in after an infected person coughs or sneezes. You can also have direct contact with the virus by kissing someone who is infected or touching a surface that has the virus, like a doorknob, and then touching your face. Hand washing is helpful to prevent getting the virus.
How is croup diagnosed?
Usually by physical exam. A child with croup can have the common cold symptoms, including congestion, fever, sneezing, runny nose. This will often progress to hoarseness, barky cough, and sometimes stridor. If a neck x-ray is obtained, sometimes you can see signs of the narrowing of the upper airway. Your medical professional may order a viral respiratory panel that can check for many different viruses, including parainfluenza virus, but this is not necessary for the diagnosis.
How is croup treated?
We usually do not give antibiotics for croup unless the child looks very sick and there is a concern for a bacterial infection. Antibiotics are for bacterial infections, not viral infections, and croup is usually caused by a virus. Most kids with croup are prescribed a course of steroids to help decrease the inflammation of the upper airways. If the child has stridor, a special breathing treatment can be given to help shrink the swelling of the upper airways.
Let's recap. Usually croup is caused by a virus, so no antibiotics are prescribed, but steroids can help. A breathing treatment can also be given if stridor is present. Is there anything parents can do at home to help with croup?
Great question. Sometimes cold air can help with the inflammation. Opening the freezer door and having your child breathe in the cold air for 10 minutes at a time may help. Moist air can also help break up the mucus and soothe the airways. A hot shower can create a steam-filled bathroom. If you sit with your child in a steamy bathroom for 10 minutes, that may help. Humidifiers are another great option.
So cold and moist air can help, like standing in the freezer, cold air outside, humidified air, and steam-filled bathrooms. What about hydration?
Keeping your child well hydrated is also key. Any way you can get your child to drink fluids is great. If you have to use a dropper or popsicle, that works. Diluting a sports drink or an electrolyte solution is often recommended. You want to stay away from sodas or sugary drinks.
Hydration with non-sugary drinks is important. What else do I need to know?
Some kids can get very sick from croup and often require hospitalization. Often kids get worse during the night when sleeping or when they get upset and cry. Some signs that your child may be getting worse include sucking in their neck, chest, or belly to help them breathe, too out of breath to talk or walk, blue lips, difficulty swallowing, drooling, very sleepy and hard to wake up, and stridor. If your child has any worsening or concerning symptoms, you need to see a doctor. And that sums up our talk on croup. Remember, none of this information should override or replace the recommendations of your doctor. We are not personally taking care of you or evaluating you. If you are concerned about an emergency or a serious medical condition, please call 911. And keep tuning in for more information about common medical conditions. Don't forget to like and subscribe if you find this content helpful.